Question number 11. An 18-year-old man presented with pain in his lower back and hip. He also complains of waking up in the night to go to washroom and has urgency as well as dribbling. What is the most likely diagnosis? Option A, BPH. Option B, prostatitis. Option C, UTI. Option D, prostate carcinoma. Option E, bladder carcinoma. So our correct answer is option D, prostate carcinoma. So here patient is an old age man of 80 years old. He has pain in his lower back at hip and he wake up at night and go to washroom for urgency as well as dribbling. So 18-year-old, so most likely diagnosis is prostate cancer. Option D. Question number 12. An 18-year-old female has periorbital blisters. Some of them are crusted, others secreting pinkish fluid. What is the most likely diagnosis? Option A, shingles. Option B, chickenpox. Option C, varicella. Option D, rubella. Option E, measles. So the correct answer is option A, shingles. 18-year-old female with periorbital blisters. So here our correct answer is option A, shingles. Question number 13. A 29-year-old lady who is bank manager and is referred by the general physician to the medical OPC due to long history of tiredness and pain in the joints. An autoimmune screen result showed smooth muscle antibodies positive. What is the most appropriate next investigation? Option A, ECG. Option B, TFT. Option C, LFT. Option D, serum glucose. Option E, jejunal biopsy. So our correct answer is option C, LFT. So here medical, so female, 29-year-old female has history of tiredness and pain in the joint and an autoimmune screen result that showed smooth muscle antibodies positive. So here appropriate next investigation is liver function test or LFTs. Question number 14. A 5-year-old with recurrent chest pain, finger clubbing with offensive stool and which is choose the single most likely investigation. Option A, endomysial alpha gliding antibody. Option B, sweat test. Option C, barium meal. Option D, ECG. Option E, glucose tolerance test. So the correct answer is option B, sweat test. So a 5-year-old with recurrent chest pain and finger clubbing with offensive stool. So our correct answer here is option B, sweat test. Question number 15. A clinical picture of the breast cancer originated from the mammary duct. Biopsy was done and there were neoplastic cells found. Choose the histological picture of the cancer. Option A, neoplastic cells are arranged in small clusters occupying a space between collagen bundles, serous carcinoma. Option B, spindle cells, neoplasm with margin which infiltrate adjacent structure, fat invaded breast sarcoma. Option C, small cells with round nucleus and scant and distinct cytoplasm, lobular carcinoma. So the correct answer here is option A. Neoplastic cells are arranged in small clusters occupying space between collagen bundles. It is also known as serous carcinoma. Question number 16. A 22-year-old man has reduced conscious level and has fixed dilated pupil after being involved in a motor vehicle collision. Choose the single most appropriate option. Option A, facial nerve. Option B, oculomotor nerve. Option C, olfactory nerve. Option D, optic nerve. Option E, trigeminal nerve. So the correct answer option A is option B, oculomotor nerve. Question number 17. A man with suspected active TB wants to be treated at home. What should be done to prevent the spread of disease? Option A, immediate start of the treatment with anti-TB drugs. Option B, all family members should be immediately vaccinated with BCG vaccine. Option C, patient should be isolated in an active pressure chamber in his house. Option D, universal prevention application protocol. So the correct answer is option A, immediate start with treatment with anti-TB drugs. Question number 18. A 7-year-old child is brought to the emergency department with 1-day history of being listless. On examination, the child is drowsy with an extensive non-blanching rash. What advice would you give to the parents? Option A, all family members need antibiotic therapy. Option B, only the mothers should be given rifampicin prophylaxis. Option C, all family members need isolation. Option D, all family members should be given rifampicin prophylaxis. So the correct answer is option A, all family members need antibiotic therapy. Question number 19. A 47-year-old man has temperature of 39 degrees centigrade and is delirious. He has developed blisters mainly on his trunk, which appeared a few hours ago. He is well and not on any medication. He last traveled 5 months ago to Italy. Which of the following is the most likely diagnosis? Option A, shingles. Option B, chickenpox. Option C, pemphigoid. Option D, bullous pemphigus. So the correct answer is option B, chickenpox. So blisters mainly on his trunk and blisters, and he has fever, blisters, and is delirious, or he is not very active, and he has travel history that is 5 months ago. So the correct, so most likely diagnosis here is option B, chickenpox. Question number 20. A 65-year-old patient has been having frequent episodes of secretory diarrhea, which is extremely watery with large amounts of mucus. A diagnosis of villus adenoma was made after endoscopy. What electrolyte abnormality is most likely in this patient? So a 64-year-old patient with frequent episodes of secretory diarrhea that is extremely watery, and it also has very large amount of mucus. So after endoscopy, villus adenoma was found. So the most likely electrolyte abnormality here is hypokalemia. Question number 21. A patient with an acute gout attack came to the emergency department. What drug should be given to relieve symptoms? Option A, NSAIDs. Option B, allopurinol. Option C, ibuprofen. So the correct answer is option A, non-steroidal anti-inflammatory drugs, NSAIDs. Question number 22. A patient was lying down on the operating table in a position with his arms hanging down for 3 hours. Soon after he woke up, he complains of numbness and weakness in that hand and has limited wrist movement, wrist drop, and sensory loss over dorsum of that hand. Weakness of extension of fingers and loss of sensation at the web of the thumb. What structure is likely to be damaged? Option A, radial nerve. Option B, median nerve. Option C, ulnar nerve. Option D, axillary nerve. Option E, suprascapular nerve. So the correct option is option A, radial nerve. So his arms has been hanging down for 3 hours. When he woke up, he complains of numbness and weakness in that hand. Weakness, extension of finger, and loss of sensation web of thumb. The most likely to be damaged here is option A, radial nerve. Question number 23. A patient who was previously on 120 mg slow release oral morphine has had dose increased to 200 mg. He is still in significant pain. He complains of drowsiness and constipation. What is the next step in the management? Option A, increase slow release morphine dose. Option B, fentanyl patch. Option C, replace morphine with oral hydromorphone. Option D, replace morphine with oxycodone. Option E, subcutaneous morphine. So the presence of constipation, and so the correct option here is C, replace. Option C, replace morphine with oral hydromorphone. So the presence of drowsiness and constipation. So the correct option is here is option C, replace morphine with oral hydromorphone. Question number 24. A 40-year-old woman notices increasing lower abdominal distension with little no pain. On examination, a lobulated cystic mass is felt and it seems to be arising from the pelvis. What is the most appropriate investigation? Option A, So the correct option here is option A, CA125. Question number 25. A resident of a nursing home presented with rashes in his finger webs and on his abdomen with complaints of itching, which is severe at night. He was diagnosed with scabies. What is the best treatment for his condition? Option A, 0.5% permethrin. Option B, doxycycline. Option C, 5% permethrin. Option D, reassure. Option E, acyclovir. So the correct answer is option C, 5% permethrin is the correct answer. Question number 26. A 34-year-old alcoholic is found passed out in front of a local pub. The ambulance crew informed you that he was sweating when they found him and there were cans of cider lying empty around him. What is the initial stage of investigation? Option A, capillary blood sugar. Option B, CT head. Option C, MRI head. Option D, ABG. Option E, MCV. So the correct option is option A, capillary blood sugar is the first initial investigation. A young boy fell on his outstretched hand and he has been presented with pain around the elbow. He has absent radial pulse on affected hand. What is the most likely diagnosis here? Option A, dislocated elbow. Option B, angulated supracondylar FX. Option C, undisplaced FX of radial head. Option D, posterior dislocation of shoulder. So the correct answer is option B, angulated supracondylar FX. Question number 28. A 65-year-old woman presented with transient arm and leg weakness as well as sudden loss of vision in the left eye. Her symptoms resolved within the next couple of hours. What is the most appropriate next investigation? Option A, CT brain. Option E, echo. Option C, Doppler ultrasound. Option D, arteriography. Option E, 24-hour ECG. So the correct answer is option C, Doppler ultrasound. Because the 65-year-old woman was presented with transient arm and leg weakness and sudden loss of vision in the left eye. So the most appropriate next investigation is question number 29. A man complains of loss of sensation in his little and ring finger. Which nerve is most likely involved? Option A, median nerve. Option B, ulnar nerve. Option C, radial nerve. Option D, long thoracic nerve. Option E, axillary nerve. So the correct answer is option B, ulnar nerve. This is the correct answer here. Question number 30. A young man complains of double vision on seeing to the right. Which nerve is most likely to be involved here? Option A, left abducens. Option B, right abducens. Option C, left trochlear. Option D, right trochlear. Option E, right oculomotor. So the correct answer here is option A, left abducens nerves.